So the purpose of this is to determine how accurate using estimated forms of height are compared to using regular standing height when calculating BMI and optimal body weight. The estimated forms we'll be using are knee height, demispan, and ulnar length, as well as we'll be using wrist circumference to calculate optimal body weight. This is important because in a clinical setting, some patients aren't able to stand, so being able to know which estimation is the most accurate will help you better carry out your treatment for them.
Okay, so to record patient height, have them remove their shoes and then stand on the tray with their feet against the back. Make sure they're standing normal and have their arms hanging loosely with the palms facing their thighs and their head at a neutral level, and then have them take a deep breath and hold it and move the headboard down so it compresses hair just enough, and then record the height. His is 169.4 centimeters, and then have them step over to the scale. This is a digital scale, so we don't have to calibrate it, just make sure it's zeroed. If it is not digital, have it calibrated and have them just step on the scale and record the number. It's 66.4 kilograms. All right, for wrist circumference, have the patient either standing or sitting, whatever they're comfortable with. Have them bend their arm and put it at a 90-degree angle, and then measure between the styloid process and like the beginning of the hand. You can just take the tape measure and then wrap it. You kind of want to overlap it some so you get the correct measurement, and it's about 16.5 centimeters.
Okay, so our next measurement that we're doing is demispan. In order to do that, you'll want to have the patient standing upright. You'll want to have him reaching out with his right hand, with his arm parallel to the ground, and his shoulder. And then you will be measuring from the tip of his longest finger, so his middle finger, to his sternum. And I'll have him point to his sternum, and then measure. Reach out and then measure. We got 86.5 centimeters. So the next measurement that we'll be doing is ulnar length. And to do that, our patient can be either sitting or standing. I will have him cross his right hand over his chest. And then what we'll be measuring is from the prominent point on his elbow to the prominent point on the wrist. So I'm going to make sure you're in centimeters. And our patient is 25.5 centimeters. Okay, so the next measurement that we're doing is knee height. And to do that, you want to have the patient sitting on a chair so that their leg is at a 90-degree angle. In order to measure that their leg is at a 90-degree angle, you'll use a goidiometer to ensure that their leg's at that correct angle. Once you have confirmed their leg is at a 90-degree angle, you will measure their knee height from the base of their foot to the top of their kneecap, and you want to have it in line with their bones. So his measurement is around 51 centimeters.
So for our conclusions, we have all of the calculations for each one of the heights for BMI and frame size. And we can see that when compared to regular standing height, the knee height seemed to overestimate the most in both categories, and demispan underestimated the most in both categories. And ulnar length came out to be the most accurate when compared to standing height. So this would be a good measurement to use in a patient who is bedridden or unable to stand, because it is a simple and easy measurement to take. When looking at optimal body weight, frame size is important because it'll determine whether you add or subtract 10% to your initial calculation. And we can see that ulnar length is again very close to standing height and the frame size. So that'll provide our accurate representation of having to subtract 10% from optimal body weight. And this can be used to help determine the nutritional status based on the patient's actual weight.